So the MDR dictates what the manufacturer must do before the device goes to the hospital. In some cases, like for in-house developed medical devices, the hospital actually also is the manufacturer. The Covenant on Safe Application of Medical Technology more or less facilitates following certain parts of European and Dutch national laws and of the MDR. But most importantly, it helps the hospital to safely choose, introduce, use and dispose of a medical device. Together, the MDR and the Covenant put several obligations on the manufacturer and on the user. In this case, we consider the hospital as a general user, because the hospital buys the medical device to utilize it or have it utilized. But of course, the actual end user in that could be a healthcare professional, caretakers of a patient, or the patient themselves. Now, the manufacturer must make sure that the device is safe, effective, and complies with all relevant rules and regulations. That's all arranged in the MDR. The Covenant states that the hospital must have procedures that ensure the right device is brought in for the right job, that the device is installed in the right conditions and in a safe way, and is used by properly trained personnel for its intended use. During the device's lifetime, it should be maintained well, and after its lifetime it should finally be disposed of in a safe manner. So, safety, safety, safety. We simply don't want to harm our patients or users. This also means that the hospital will be responsible for and has to act responsibly in cases when the benefit-risk ratio of off-label use is high enough. Because although we should of course always strive to stay on-label, life sometimes simply gets tough and the patient must be helped. So in case of essential medical devices, parts or consumables not being in stock or not being available, it may be necessary to use some other device outside its intended use in order to save a patient. After all, when emergency calls and your first aid kit is empty, everything can be replaced by duct tape. But preferably not, right?